Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
The first thing that I have often observed is education before we can educate on the opportunities for clinical trials. Absolutely, education on risks of various kidney diseases, including rare and genetic causes of kidney diseases, as well as what happens with acute injury and how that can lead to chronic kidney disease. That's imperative. Across the board, though, despite what condition we're talking about or what etiology of kidney disease, I think we really need to help people understand how we get from a new treatment, whether it's compound or device, to approval in the market. I can tell you that I have some relatives who are a little bit older, and they remember stories of how warfarin was based on rat poison. I mean, when that's in your mind, you're not really educated on the robustness of how we do research and development, how stringent the criteria is for compounds to move forward through the different phases of research from phase 1 through phase 4. In addition, the oversight of the FDA for both approval of compounds and devices. So I think there's a lot of opportunity to actually educate on what we do. And advocacy groups such as AAKP, which are so patient focused, I think can really go a long way in helping people understand not only their condition and the opportunities for research, but what research is and how those opportunities translate into the treatments of tomorrow. My journey with kidney patients has evolved over time. So first and foremost, I am a primary care PA, which is what brings me here today. I'm now also involved in industry as a medical affairs lead for CKD patients and topics related to our research in that area. But most important to me personally is my role as caregiver. My mom had both type 2 diabetes and systemic lupus. And so for most of my life, I was along that journey with her. And she did develop kidney disease as a result of those conditions and probably accelerated by having both conditions. So my journey also involves the caregiver perspective. And I think when we talk about patients and the importance of receiving their feedback into things like research, development, and clinical trials, it's important to consider their whole support ecosystem, inclusive of caregivers, because often caregivers have an incredible role, sometimes more so than the provider's input into what patients are doing with their choices. In addition, when we think about, how this is reconfirmed, my thoughts on this topic, I think that it's foundational. I mean, frankly, there is a massive opportunity to truly collaborate and partner with people living with the conditions under study, in this case, kidney disease, everyone that's involved in their decision making. We may have the best hypothesis possible and a great trial design, but if something doesn't work for the person that we're trying to see how the medication may affect them versus placebo or standard of care, then it's going to be impossible to enroll people. So I really do think we need to shift into that mindset of a long-term partnership along this whole pathway. In terms of barriers to innovation, I mean, I'll speak as a primary care provider. I think we should really think broadly about innovation. Sometimes we can get into a silo of looking at one thing that we think is innovative and try to continue to go deeper. But here as a primary care provider, I like to think about the breadth of the opportunity for innovation. Certainly from a barrier perspective, I remember back to my clinical days when you have a very limited amount of time with each person. So the key barrier that pops to my mind is, how do we look at someone holistically in the time frame that we have? In regards to innovation, the first things that come to mind for me aren't necessarily treatments or devices, but rather, how do I have the new systems like EMRs be integrated more holistically? How can I overcome alert fatigue so that I can get the information I need in the most prioritized way, especially when the person in front of me probably has several coexisting conditions like diabetes, high blood pressure, high cholesterol. They might be a little overweight or obese. And how do I really integrate innovation so it fits the person? And the person doesn't try to fit into what we think is innovation. So for me as a primary care provider, if I could wave a magic wand, innovation would be very broad and patient-centered to make the lives of those at the front lines much easier. So this is a question really near and dear to my heart, and I'm sure one that is very important to all my colleagues at Boehringer Ingelheim as well. So our company North Star is value through innovation. I can talk very briefly about my journey in the care and seeking new innovation for people with kidney disease and associated conditions. I've actually been working on this for the last 5 to 6 years, both through pipeline and supporting the medical aspects of our early phase studies, and also working on an indication seeking study for one of our marketed compounds. Something I want to shift the focus to a little bit is a recent example of innovation that is led by both Boehringer Ingelheim and our partner Eli Lilly, and that's really to bring awareness to health disparities, particularly in women with heart failure. So we know that women with heart failure occur about as commonly as men with heart failure, but women with heart failure have poor outcomes. In addition, women who are either Black or Latina have even greater health disparities and inequities. So we have recently launched in April an educational campaign to raise awareness of these disparities and health inequities, specifically among women with heart failure and those at greatest risk of poor outcomes within that group. So for me, the heart and kidney connection can't be overlooked. I think it's really important that people understand how the organs all work and connect together, the two of which that are most interconnected being the heart and the kidney. So while I do strongly believe we're bringing innovation today and in the future for kidney patients, I do want to highlight this innovative opportunity to also raise awareness for women living with heart failure because of those interconnected systems, and anything we can do to help bring more people to the proper kidney care with conditions like heart failure, diabetes, high blood pressure, obesity, it's critical to the long-term success of all of our kidney efforts.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.